guys, welcome back to my channel. So today we are going to be talking about the gross anatomy of the mediastinum. What is the mediastinum? The mediastinum is the median septum of the thorax between two lungs. So if these are the lungs, then you are having the mediastinum. Then the major content of the mediastinum is the heart, and this heart is enclosed by what we call the pericardium, which is present in the middle mediastinum. Now, before going into the details about the mediastinum, I'm going to be giving you outline on how to answer the questions on gross anatomy of the mediastinum. So the first one is the introduction, which I have just done. The second one are the boundaries of the mediastinum. The next is the division. Then under the division, we are going to be having introduction, boundaries, content, and finally the clinical correlates of the mediastinum. Now let's dive into the business of the day. So for the boundaries of the mediastinum, we are having the mediastinum is bounded anteriorly by the sternum. Okay, now this is the mandible sterni. This is the body of the sternum. And this is the xiphi sternum. So anteriorly, the mediastinum is bounded by the sternum. Superiorly, it's bounded by the inlet of thorax. Now, this inlet of thorax is an opening that you can see on the upper part of the thoracic cavity. Then it is bounded posteriorly by the vertebral column. So these are the vertebral column. And it's bounded inferiorly by the diaphragm. So this is the diaphragm. And finally, on each side by the mediastinal pleura. So generally, the mediastinum is bounded anteriorly by the sternum, posteriorly by the vertebral column, superiorly by the inlet of thorax, inferiorly by the diaphragm, and on each side by the mediastinal pleura. Now, the mediastinum is divided into the superior mediastinum and the inferior mediastinum. So these are the inferior mediastinum. So this, and this are the inferior mediastinum. Now this is the anterior mediastinum. Now the inferior mediastinum is divided into three parts by the pericardium. Now we are having the anterior mediastinum. So this part is the anterior mediastinum. So this is the anterior mediastinum. Then this is the middle mediastinum. I remember that the heart is present in the middle mediastinum, which is enclosed or covered by the pericardium. Then finally we have the last part of the inferior mediastinum, which is the posterior mediastinum. So let's take it all over again. The mediastinum is the median septum of the thorax between two lungs. Its major content is the heart, which is present in the middle mediastinum and closed by a pericardium. The mediastinum has boundaries. Anteriorly is bounded by the sternum, posteriorly is bounded by the vertebral column, superiorly is bounded by the inlet of thorax, inferiorly is bounded by the diaphragm, and on each side is bounded by the mediastinal pleura. Now the mediastinum is divided into two, the superior mediastinum and the inferior mediastinum. Now the inferior mediastinum is divided into three parts by the pericardium. We have the anterior mediastinum where the pericardium is in front, the posterior mediastinum where the pericardium is behind, then the middle mediastinum, where the pericardium is present with the heart and its what? Content. Let's label the remaining part. So this is the sternopericardial ligaments. Now this is branches of internal thoracic artery. So these are for the introduction, the boundaries, and the division of the mediastinum. Now let's take the first one, which is the superior mediastinum. Now this is the superior mediastinum, okay? Now this superior mediastinum is separated from the inferior mediastinum by an imaginary plane, okay? That is passing what? Through the sternal angle anteriorly and the lower border of the fourth what? Thoracic vertebrae posteriorly. So that's the introduction of the superior mediastinum. Now let's go back to the boundaries of this superior mediastinum. Anterior is bounded by the mandible sterni. Posteriorly is bounded by the T1, that's the first thoracic vertebrae to the fourth thoracic vertebrae. Inferiorly is bounded by an imaginary line that is passing between the sternal angle and anteriorly and the lower border of the fourth thoracic vertebrae posteriorly. Then superiorly it is bounded by what? An imaginary plane of the inlet of thorax. Then on each side it is bounded by the mediastinal pleura. Now let's talk about the contents of the superior mediastinum. Now the superior mediastinum has about 8 contents, and there are things you are going to get and mnemonics to remember it. We have toma, V, N, L, T raised to the power of 2. Then T refers to the trachea, esophagus. The muscles include the sternocleidomastoid muscles, the sternothyroid muscles, and the branches of the longus colli muscle. Then we are having the next one, the arteries, the veins, the nerves, the thymus, the thoracic duct, and the lymph nodes. So these are the contents of the superior mediastinum. I'm going to be using a diagram to explain the contents of the superior mediastinum.
The contents include the trachea and the esophagus, as I've said initially, the muscles that include the origin of the sternocleidomastoid, the sternothyroid, and the lower ends of the longus colli muscle. Then we have the arteries, which include the arch of the aorta, the brachiocephalic artery, left common carotid artery, and the left subclavian artery. Then for the veins, we are having the right and the left brachiocephalic veins, the upper half of the superior vena cava, the left superior intercostal veins. Then going into the nerves, we have the valgus nerve, the phrenic nerve that supplies the diaphragm, and then the cardiac nerves of both sides, that's the left recurrent laryngeal nerve. Then we finally have the thymus, the thoracic duct, and the lymph nodes, which include the paratracheal, brachiocephalic, and tracheobronchial lymph nodes.
So having explained the superior mediastinum, let's go into the inferior mediastinum. So the inferior mediastinum is divided into 3 parts by the pericardium. The first is the anterior mediastinum, the second is the middle mediastinum, the third is the posterior mediastinum. So let's take the anterior mediastinum. The anterior mediastinum is a narrow space that presents the pericardium in front, while the middle mediastinum consists of the pericardium and its contents. Remember that I said that the heart is the major content of the middle mediastinum, which is enclosed by a pericardium, okay? Now finally we have the posterior mediastinum that presents the pericardium behind it. Now let's take the boundaries of the anterior mediastinum. Anteriorly, the anterior mediastinum is bounded by the body of the sternum. Superiorly is bounded by an imaginary line that separates the superior mediastinum from the inferior mediastinum. Inferiorly is bounded by the superior surface of the diaphragm. Posteriorly is bounded by the pericardium, and on each side is bounded by the mediastinal pleura. Now let's talk about the contents of the anterior mediastinum.
Its contents include the sternopericardial ligaments, the lymph node with their lymphatics, small mediastinal branches of the internal thoracic artery, areolar tissues, and finally the lowest part of the thymus.
Now, having talked about the anterior mediastinum, let's talk about the middle mediastinum. Remember that I told you that the middle mediastinum consists of the major content, which is the heart, enclosed by the pericardium. So it consists of the heart, the pericardium and its content, that's the pericardiophrenik vessels and the phrenic nerves. Now let's talk about the boundaries of the middle mediastinum. Anteriorly, the middle mediastinum is bounded by the sternopericardial ligament. Posteriorly is bounded by the oesophagus, azygous vein, and descending thoracic artery. So, anteriorly is bounded by the sternopericardial ligament. Posteriorly, the middle mediastinum is bounded by the oesophagus, the azygous vein, and the descending thoracic artery. Then on each side, it is bounded by the mediastinal pleura.
Its contents include the heart that is enclosed in a pericardium, the arteries which consist of the ascending aorta, the pulmonary trunk, and the two pulmonary arteries, that is the left and the right pulmonary artery, the veins that include the terminal part of the azygous vein, the left pulmonary vein, the lower half of the superior vena cava. Then the nerves include the phrenic nerve that supplies the diaphragm and the deep cardiac plexus. The lymph node include the tracheobrachial nodes, and then the tubes include the bifurcation of the trachea.
Now let's talk about the last division of the inferior mediastinum, which is the posterior mediastinum. Now this is the posterior mediastinum. Anteriorly, the posterior mediastinum is bounded by the pericardium, the pulmonary vessels, the bifurcation of trachea, and the posterior part of the upper surface of the diaphragm. Now posterior is bounded by the lower T8 of the thoracic vertebrae and its intervening disc. Now on each side, it is bounded by the mediastinal pleura.
The contents of the posterior mediastinum includes the oesophagus, the arteries that include the descending thoracic artery and its branches, veins that include the azygous vein, hemiazygous vein, accessory hemiazygous vein. Then the nerves that include the vagus nerve, the splanchnic nerve, that's the greater, lesser, and the least splanchnic nerve. This nerve arises from the lower 8 thoracic ganglia of the sympathetic chain.
Now let's take it all over again. I said that the mediastinum is the median septum of the thorax between two lungs, okay? It consists of the heart, which is present in the middle mediastinum and closed by the pericardium, okay? Now we have the boundaries, which are the general boundaries of the mediastinum, which we have discussed earlier. We have the divisions, which are the superior mediastinum and the inferior mediastinum. Then each of this mediastinum has their own boundaries and contents, okay, which we have also discussed. Now the inferior mediastinum is divided by the pericardium into 3 parts. So the pericardium divides the inferior mediastinum into 3 parts. We have the anterior mediastinum, the middle mediastinum, and the posterior mediastinum. Now we have talked about them and their contents. Now let's go into the clinical correlates of the mediastinum. So let's talk about the clinical correlates of the mediastinum. We are having the mediastinal syndrome. This can occur as a result of compression of these mediastinal structures. You know, there are various contents that are contained in the mediastinum. So when there is a compression of these structures, it can lead to what we call the mediastinal syndrome. And this can result to what? Tumor. So the symptoms can include 1. Dysphagia, which can be caused by pressure on the oesophagus. You know that the oesophagus is one of the contents of the mediastinum. Now, dysphagia is a damage to that part of the brain that is responsible for language production, okay? It can be as a result of head injury, stroke, or other neurological conditions. So when there's a pressure on the oesophagus, it can lead to what? Dysphagia. The next one we are having is paralysis of the diaphragm caused by pressure on the phrenic nerve. You know, the phrenic nerve is the nerve that supplies supplies the diaphragm. So when there is paralysis of the diaphragm, it's as a result of pressure on that nerve that supplies the diaphragm. Now the next one we are having is the intercostal neuralgia. This is as a result of pressure on the intercostal nerves. You know, the intercostal nerves are the nerves that supplies the muscles of the thorax, that is the intercostal muscles, which are the external intercostal, internal intercostals, and the innermost intercostal muscles. This can give rise to pain in the area of in the place that the muscles have supplied. Okay. Now the next one we are having is the hoarseness of voice as a result of pressure on the left recurrent laryngeal nerve. Now this left recurrent laryngeal nerve is one of the contents of the superior mediastinum. Now when there is a hoarseness of voice, it can result to pressure on that particular nerve. The next one we are having is cough and dysphonia caused by pressure over the trachea. This is as a result of shortness of breath. This causes shortness of breath. Okay, when there's pressure over the trachea, it can lead to cough and dysphonia. Now the next one we are having is the engorgement of veins in the upper half of the body, which is caused by the obstruction of the superior vena cava. So if you have stayed to the end of this class, thank you for staying and thank you for watching to the end of this class. My name is Jerry Onyi. I'm a basic medical lecturer and an online tutor. I have an educational channel on YouTube where I post most of my videos on anatomy. I also have a Facebook page as well where I post notes from the videos on YouTube on that particular place. So please, if you find my lectures interesting, do well to subscribe to my channel. Please like my videos, share my videos, turn on your notification bell so you'll be notified anytime I make a video. And also drop a review on the comment section of this video. Thank you all for staying to the end of this class. Have a lovely day. See you guys in my next class. Bye.